Dr. Garth Graham is Deputy Assistant Secretary for Minority Health in the Department of Health and Human Service. Dr. Graham earned an MD from Yale School of Medicine, where he graduated cum laude. He was inducted into Alpha Omega Alpha Medical Honor Society and named a Yale President Public Service Fellow. He also earned an MPH from the Yale School of Epidemiology and Public Health with a focus in health policy administration. Let's receive Dr. Graham at this time.
All right. Thank you very much. Good afternoon. That sounds like a well-fed group. My name is Garth Graham, and I'm the Deputy Assistant Secretary for Minority Health at the Department of Health and Human Services in Washington, D.C. And the long and short of that long title is we're the federal program or office that's in charge of the health disparities agenda for the Department of Health and Human Services. If you were to take the Department of Health and Human Services and kind of make it into its own little country, we'd be about the 8th or 9th largest country in the world, and this is pre-America Recovery and Reinvestment Act funding. So it's a large agency mirroring a lot of the funding in terms of bulk. VA and Defense are some of probably our only other kind of sister agencies in terms of that magnitude. So it's a job that I love. But more importantly, what I'm going to talk to you about today is what I believe are some of the potential solutions in terms of the melding and the ideas around both the economic development, particularly as it pertains to minority communities, and certainly this issue of health disparities. I'll tell you that you heard a brilliant background as well as some very insightful ideas from Dr. Smedley and others. And what I'm going to call this is kind of the part 2 to Brian's talk. So I'm going to skip a lot of what I was going to talk about in terms of segregation, because Brian covered all of that already. But more importantly, I want to talk to you a little bit about what I think is important. And I want to give you a snapshot in terms of some of the activities that are occurring at the federal level, health reform, and where we think that's going. And I can tell that I'm going to be very positive about things. I think health reform is a good thing. It's a well-needed thing. Before I go any further, I'm also going to tell you that I'm going to base a lot of my insight on a very, very smart, amazing person who is not here today, and it's my mother. So you're going to get a lot of quotes from Mom, and that's because I'm going to give you a lot of things that I actually genuinely believe in terms of where I think we should be going, both here locally, but certainly nationally, and a lot of things that we're also leading on behalf of the department overall. Before I even go any further, I should tell you greetings on behalf of my boss, Secretary Kathleen Subilis, who's the Secretary of Health and Human Services, who I'm actually surrogating for today. And she is somebody who is very, very, very in tune to these kinds of issues and has health disparities as a top priority for our department. So let me start off with my first mom quote. And it was my mom gets a lot of quotes from different people, so that's something I don't know where she gets it from, but it's always on point. And one of the things she said is, in school you're taught a lesson and then have a test, but in life you have a test that then teaches you a lesson. And that's important to understand, because I think there's a lot we can glean from our life experiences individually that we should kind of bring to the table, both individually and collectively. So you heard a little bit about my educational background, but I'll tell you that pales in comparison in terms of life experiences that have benefited me for understanding what needs to happen in the job that I hold today. So forgetting about Yale and Harvard and all of those things, I'll tell you that when we first came to this country many years ago, we were broke. And we lived broke for a number of years. I'm not even sure if I'm totally out of that category yet, but we dealt with a lot of the issues that I'm dealing with from a policy perspective. So when I come to work every day, this is not a generic job for me. This is about life experiences. And I'll tell you, and I was hearing a little bit about the discussion this morning around challenges around transportation and challenges around education. And I'm going to give you 2 seconds on my own life trajectory so you can understand what I think is going to be important for dealing with this issue around health disparities. So as I said to you before, came here, we had about $180 and there was about 7 of us. That's including my 2 parents. One of the interesting things, and I'm going to start off with this understanding, is one of the most important things you can give both an individual and a community is a sense of self, right? And so I want to start on that and build on to 3 or 4 different tiers of action items that I think are important for understanding where we move, like I said, both individually and collectively. So when we first came here, and I was telling you we didn't have that much money, but we had this very strong sense of self. And that was another gift given to me by that great person, my mom, that I'm going to keep talking to you about. Because I think that's going to be important for empowering communities. Is empowering individuals and then empowering communities, both from a government perspective and from a private perspective as well. So even though we didn't have a lot of money, we didn't really even know it at that time. It's kind of one of those interesting things. And sometimes not knowing you're broke is the most empowering vehicle for getting out of brokenness. So we just loved each other, and life was good, and the little things. If it was a beat up car, we were like, well, that's our car, and we certainly appreciated that was, quote unquote, the family car. And so that kind of non-self-defeating philosophy from the very onset was a very mobilizing factor in terms of each of us being able to move forward and utilizing education as a tool. So we talked this morning about what are some of the tools that the communities need to succeed. We talked about education, we talked about transportation, and Brian touched a little bit on this issue of segregation, the ability to be mobile both in your mind and certainly be mobile both physically in terms of being able to access various things. And I'll tell you that I believe that one of the foundations, starting from that sense of collective empowerment, and I'm going to tell you how this even ties to health reform, amazingly so. Just stay with me. Stay with me. We're going to go through some hills and valleys, but we're going to get there. Is you got to start with a sense of community empowerment. A community that is disenfranchised for a number of different reasons. You can throw as much money as you want at it. You can throw as much anything you want. If communities aren't empowered and engaged, you're not going to get anywhere. And again, like that starts from my own individual life experiences, and certainly, like I said, from looking at things collectively. Then moving on in terms of what are some of the prime vehicles for us. Well, when I first started to realize that life was good, but there are other things to life in terms of where we lived and where we needed to go. My mom did something interesting to me. She she introduced to a group of her kids what are some of the potential educational opportunities that were out there. A lot of those things were things that were helpful from a government perspective, but she also made us realize that we need to be able to speak different languages to communicate to people in different ways. Stick a pin there, and I'm going to tell you now how that pertains to this issue of both economic and social development. After I took on leadership of our office a couple of years ago, we engaged a national business group on health, which is one of the national kind of organizations that help advocate for business communities. And we formed with Helen Darling, who's an amazing, passionate leader, who's the CEO of the National Business Group of Health. We formed a board to look at the issue of health disparities in businesses. And we got the folks from Chevron, we got the folks from Prudential, we got a number of leaders from a number of different folks within the business community to kind of talk to each other about this issue on health disparities. Tell you one of we had the board meet over a 2-year time period, develop some draft reports, develop all kinds of different things. And I'll tell you what the findings of those reports were in terms of looking at big businesses and the issue of health disparities. One was that the majority of employers were unaware of disparities as a business issue. Not only were they unaware, but they were, for lack of a better term, not motivated to engage health disparities as a business issue. Keep in mind, I'm on the language point here, so I'm going to get back to that point. Few employers had undertaken efforts to make employees aware of strategies they have implemented to reduce healthcare disparities. A few that did, and the potential for reducing disparities was not generally a criteria for prioritizations in businesses in either when they were looking at the health plans that were available to their employees, but also being able to just even think of addressing health disparities in the economic context. Why is that important? Because part of the language that we speak has to be bilingual. If we think about business or economic development as a mobilization vehicle for communities to get better health, we need to start creating more interlocking conversations between the business community and our traditional health disparities communities. And that's going to be an important context, because what we found in that initial report is that not only is the divide large, but there are very few connecting spokes in between. Earlier on, one of the questions, some of the questions came, comments that came to the prior panel's discussion was, we need to start from the ground up or whether we need to start talking to business leaders from a top-down approach. We need to do both. Because if you don't have both, what you'll end up happening is people talking different languages and going in different directions. What I mean by that, it means that if we have the great community efforts that we all love and that we get engaged in and that make us feel empowered, going back to that first point, but we're talking a totally different language from the business and the economic community, we're going to miss them. And right now we're missing them. And the very few linkages we have right now is part and parcel of why, much in terms of business and private sector investment, and if you think about the American economy, government plays a strong role, but the majority of mobility in America comes from small business and large business direction. Okay, that's just a generic fact. So being able to mix those two and have very integral conversations is important. So that goes back to mom lesson number 2, which is learn the languages. And understand the dialects and understand the lexicons, because business folks are not thinking about community-based solutions the same way we think about community-based solutions. And we need to be able to make those linkages. All right, going back to Sybil Graham, which is my mom. So then the other thing then she taught us was identifying mobilization tools and strategies and working with it. Now, I was halfway good in school. My brother was really good with his hands. And my sister had a combination of both and was just more street smart than all of us. And each of us, what she encouraged, was to understand our strengths, develop those strengths, utilizing the self-empowerment that she had given us, as well as the ability to talk to different folks in different ways, to kind of combine that with our own individual strengths. So I chose education, which we all kind of chose education different ways, but I kind of took it all the way by spending the whole of my life in school. But I chose education as a vehicle, and I tell you, for people in poverty, education can be a tremendously transforming factor. I mean, you know, just test after test and studying and doing things and getting to each different level opened up all kinds of opportunities for myself that I would never have perceived even the couple of years before. And I always go back to thinking about even a story that I always tell some young folks and some mentoring stuff that we do, is that, you know, not long ago I had the opportunity of bringing my mom to the White House to meet the president. And if the one tool that allowed that day to happen, which is one of the proudest days of my life, was education. Because education opened up opportunities, that opened up abilities for advancements that allowed me to not only feed myself and help feed my family, but also to bring new experiences that opened up all different kinds of ideas. Why is that important? Because I do believe education is one potential vehicle for mirroring and marrying these issues around health disparities and economic development. But you gotta be very concrete when you say education. And a lot of times when we get into health disparities discussion strategies, we're very generic, we're very passionate, and we believe in what we say, but it's gotta be really, really, really concrete. So what do we mean when we say education? Are we talking about K through 12, investment strategies, mobilization, self-empowerment strategies there, or are we talking about other degrees of education? So one of the things she again taught us was just be very concrete, understand strengths, weaknesses, and then, you know, it's good to daydream for a little while, but then you gotta move into action. And it's good to kind of spend some time thinking, oh, I'd love to be a baseball star, but if you can't play baseball, it's not gonna happen. So go into the issue that the area where you have your strength, invest there, and spend your time there, and then build inroads and build strategic connections there. So that's important. Here's another thing that kind of ties into all of that. Most of whatever happens in America that really gains traction starts locally. America is an interesting political kind of dynamic. Those of us who work in DC, all we really care about is what's happening outside of the Beltway, right? We really care about what's happening here. You might think that all the power is in DC, but people get to DC, especially the elected officials, by having local power bases. So local power bases are particularly important. Why is that? Going back to kind of my mom's strategies, remember I was telling you that she said, understand your strengths. And the strengths in local community activities is that they are local. So you got to build on that, exploit that, but have concrete actions and then move forward. All right. Kind of getting to kind of the crux in terms of some of the things I think you need to think about in your afternoon session. The other thing, the last thing I'll tell you about Mom that she taught us to be is very self-aware. So when you understand, so you're kind of empowered, You picked your strategy, you're moving down your strategy, but you got to be aware of everything that's morphing and changing around you simultaneously. As we were using education as my personal vehicle, my sister was using all kinds of business technology stuff and moving with the technology market and being very aware of things that are happening. These were just things that made us be able to go from, thinking, 425 an hour was the best that we could do, understanding that there were other pay grades above that. But you don't know that when you're just there, right? And that's why you need those tools to be able to step on other things to then see over the mountain eventually when you get there. Why I say to be very self-aware. I told you that most of the power that folks have are in local coalitions or local grassroots activities. You see that on TV every day. You see that in terms of political awareness. Brian's last slide that he showed in terms of the WHO statement, if you look at those last three kind of PowerPoints, those last 3 points in terms of kind of potential agents for change, I tell you that at least 2 of those 3 are potential local engines. But you also have to be aware of what are all the other dynamics that are occurring around you at the same time. And so understanding a lot of what's occurring on the federal level, a lot of how to utilize federal investments appropriately. But if anyone believes that it's going to be an entirely federal effort that's going to transform, we all know that's never going to be the entire solution. And that goes back to the idea of being able to speak different languages, or at least understand and read different languages. You got to read the government speak, you got to read the private sector business speak, you got to read your own community people speak. And then you have to be able to kind of morph all of that together. So whatever you build has to have a little bit of both. But if you have over-reliance on one versus the other, it's only going to get you down one path, but not all the way. That was the last point I was going to make in terms of understanding to be very self-aware, because she taught my sister that, my sister taught me that. And this idea of constantly paying attention to all the fluid things that are changing. Right now, healthcare is changing in the largest way possible. There is a dramatic effort that's already underway in terms of implementation around health reform. We chair a whole bunch of work groups and do all kinds of stuff, and everybody is living and has absorbed my personal life entirely, is living health reform implementation. It's what we're all working on at the federal level night and day, because many of us believe that this is a key factor for moving forward. But you all need to understand what are the key cogwheels in health reform, what are the key cogwheels in terms of federal government investments, to be able to mobilize that and utilize that in terms of all those different ingredients. I'd be remiss if I didn't spend 10 minutes telling you what I thought were the things that we're implementing at the federal level around health reform that I think are going to be particularly important. Well, with the American Recovery and Reinvestment Act, there are a number of things that moved forward. One was something called a Communities Putting Prevention to Work initiative, which is a big federal initiative based around the ideas that Brian alluded to in terms of investing in communities and trying to bring community coalitions together and trying to change the way people interact at a local level by using the federal funds to bring folks together. That's an example of where y'all should know about those things. And you should know who the grantees are in this area, because that's where the money is flowing, and that's a government language, okay? So that's part of what I'm saying in terms of understanding that. You should understand what are the health reform changes that are going to occur on September 23rd, because that's 6 months after implementation. There's some key things coming now, which I'll tell you about in 2 seconds. The things that are going to be January 1st, 2011, things that are going to be on March 23rd, 2011, and the things that are going to be happening 2012, October, and then in 2014 in January. Those are key dates for anybody who's involved in healthcare. Okay, let me give an example of what's going to change as of September 23rd. Well, a lot's changed as of March 23rd, 2010. That's when the law was signed into place. And regardless of whatever your feelings are, it's happened. It's a law, it's happening. People are working on it, it's going to happen. So you got to understand it and then use it to be able to utilize those benefits. So all kinds of things happened as of March in terms of health insurance reform. A lot of those things were directed primarily towards making sure that insurance plans covered more preventative services, and certainly making sure that insurance plans were more adapt to what we believe were important for a number of Americans. as of September 23rd, insurance plans young kids are going to be able to stay on their their parents' insurance plans longer. As of September 23rd, there's going to be increased coverage for preventative services for a number of different things. Now, why is that important for people to understand? Let me tell you one thing about preventative services and federal investment. Started in the early 90s, the federal government started covering flu shots for everybody. Medicare started paying for flu shots for everybody. So you would think the fact that Medicare is paying for flu shots for people over the age of 65, when I say everybody in Medicare, paying for people over 65, everybody will rush and take advantage because who wants to get the flu? That's not what's happened. And in fact, what's happened is there have been huge disparities between minority communities and majority communities when it comes to flu vaccinations. And there are huge disparities in terms of death rates from H1N1. There were some interesting community data that showed huge disparities in terms of minority communities. So sometimes just having a federal infrastructure that provides something doesn't lead to change if people don't take advantage of it. That means people have to understand it, understand what the benefits mean, understand what that language is, and then be able to implement it for their personal life. Does that make sense? And so I never want to believe that because we put out a government plan on Tuesday, the world changes the following Tuesday. The world only changes if people understand the plan and then adapt that to their own best benefit. Now, I'm not saying everybody should go and get the flu shot, but people who are sick should get the flu shot because there's a lot of data showing that if you're diabetic, if you have comorbid illnesses, if you are over a certain age group, that getting the flu is a pretty serious illness. In fact, last year, I also practiced clinically. It was amazing to us sometimes when we saw young people die from H1N1, and that was a scary, kind of a scary fact. But then we would offer H1N1 on college campuses, and young people say, "Oh, we don't want that." I'd be like, "All right, that's interesting." And so, we had very young people dying from H1N1 last year, and we had that was the first year that the government was providing free flu shots. And we had a lot of challenges with uptake in minority communities, okay? So this leads back to just understanding all of the different things that are in place. And why is that again important? Because you have to be aware of everything that is occurring and that's morphing, and then what that means for your local community-based activities and things you want to achieve. All right, quick review on the mom lessons, just so you remember where I was coming from. And why I think it's important for your follow-up discussions this afternoon and what potentially can come from here. One, you have to understand that change will only occur when people like you come together with the brain power and feel empowered at their appropriate level. And I believe, quite frankly, that as Brian alluded to in his earlier comments, that the ingredients for change are here, but it's about how people feel empowered to be able to mix and mingle that together. So everything starts with that kind of individual first level of self-empowerment. Then the thing you have to then kind of move from there and understand is don't just speak one language. Certainly be able to understand the community grassroots appeal, but then morph and understand what's going on in the business world. A lot of business leaders we found from our work with the National Business Group and Health, they weren't racist. They were just thinking green, while we were thinking another thing, okay? That's not a bad thing. Sometimes thinking green in different ways can be deleterious to communities, but that's the kind of language and that's the lexicon that they were thinking. And if you use some of the data that the Joint Center has come up with and a lot of folks have come up with, and they start to explain to businesses in another way, then they start to see green in a different way, and they start to kind of meld different communities. But, we got a lot of the big business leaders saying, no offense, this just wasn't important to us because of X, Y, and Z. Does that make sense? Moving on past that point, you have to then understand what are all the things that are changing, particularly in healthcare around you, particularly being cognizant of those dates that I just threw out to you and knowing that things are going to change in the next year or two. Because if you don't empower the community to take advantage of all those changes, they will happen. And things will be there, but the health benefits that we want to see on the grassroots level won't occur because you'll have infrastructure in place, but you won't have people taking advantage of the infrastructure appropriately. And so that combination is the only way we're going to see success overall. I'm going to try and truncate my points to so hopefully answer your questions. And the reason why I didn't come here and just tell you about all the great government programs that we have going on at a federal level is I don't think that's the kind of discussion we all need to have here today. And the kind of discussion you need to have if you're thinking think tank is, how do you kind of create change and make your time and your efforts and your brain power be effective. And hopefully we've all learned a little bit from Sybil Graham, i.e. my mom, in terms of what I believe are some of the potential ingredients. And that's not the end all be all. In fact, when the president talked about health reform, he always said this was the start. This wasn't the end. And I think that we have to be able to look at changes that are occurring now as a start and not the end. Because if it's the end, then there's not much more that needs to be done, right? But if it's a start, then we understand that there's tons of work ahead in terms of everything that we need to do and accomplish from here on. I want to stop there and answer any questions you have on anything that I've talked about today. But anything that I didn't talk about and any of the questions or ideas, even issues that you might have with talking about health reform or the American Recovery and Reinvestment Act or some of the other major things that are coming out of our department. So thank you again. Certainly again, I want to recognize the other folks who said things more eloquently before myself, but I do believe that there are some potential, there's a lot of potential here, and actualizing the potential is going to take a lot of those ingredients, hopefully, that I mentioned earlier. Thank you. Any questions? Okay. If there are no questions, I'm going to slide off and finish eating. Thank you all for having me here today. And feel free to email me or any questions that you might have on anything that we're doing at the federal level. Thank you.